Sat Sri Akal and welcome to another ultimate health performance show or ultimate body performance show ਜਿਹੜਾ ਆਪਾਂ ਇਸ ਸਾਲ 2018 ਦੇ ਵਿੱਚ ਸ਼ੁਰੂ ਕੀਤਾ ਔਰ ਚਰਚਾ ਕਰ ਰਹੀ ਹਾਂ ਮੈਂ ਮੇਰੇ ਹੋਸਟ ਨਾਲ ਵਧੀਆ ਟੌਪਿਕਸ ਤੁਹਾਨੂੰ ਲੈ ਕੇ ਆ ਰਹੇ ਨੇ ਇੰਗਲਿਸ਼ ਤੇ ਥੋੜੇ ਪੰਜਾਬੀ ਦੋ ਬਾਈਲਿੰਗੁਅਲ ਕਰਾਂਗੇ ਲੈਂਗੁਏजेस ਕਿ ਦੋਨੇ ਜਿਹੜੇ ਸਾਡੇ ਬਜ਼ੁਰਗ ਔਰ ਸਿਆਣੇ ਬੈਠੇ ਨੇ and the third generation maybe sada accent of English is very fast and you can't keep up with it, so I'm going to be gelling a little bit of English in between, keeping within confinement of that topic of the day. Charcha kar rahe si assi first half de vich Kori jehde sare duniya da manniya hoya ਮਾਰਸ਼ਲ ਆਰਟਸ ਵਿੱਚ ਉਹਨਾਂ ਨੇ ਬਹੁਤ ਵਧੀਆ ਮੈਡਲਸ ਹਾਜ਼ਰ ਕੀਤੇ ਨੇ ਔਰ ਉਹਨਾਂ ਦੀ ਗਿਫਟ ਔਰ ਆਰਟ ਜਿਹੜੀ ਸੀਗੀ ਉਹਨਾਂ ਨੇ ਮੇਨਟੇਨੈਂਸ ਕਿੱਦਾਂ ਕੀਤੀ ਐਂਡ ਹਾਊ ਉਹਨਾਂ ਨੇ ਮਾਸ ਮੀਟ ਛੱਡ ਕੇ ਹੀ ਬਿਕੇਮ ਵੈਜੀਟੇਰੀਅਨ ਸੀਕਿੰਗ ਇਨ ਫॉर ਦ ਗ੍ਰੀਨ ਪ੍ਰੋਟੀਨਸ ਐਂਡ ਉਹਦੇ ਵਿੱਚ ਉਹਦੀ ਫੈਮਿਲੀ ਨੂੰ ਕਿੰਨਾ ਵਧੀਆ ਨਾਮ ਮਿਲਿਆ ਐਂਡ ਉਹਨਾਂ ਦੀ ਘਰਵਾਲੀ ਡਾਕਟਰ ਹੈ ਰਾਣੀ ਹੈ ਐਂਡ ਹਿਸ ਸਨ ਬੱਚਿਆਂ ਨੂੰ ਵੀ ਦੇ ਐਂਡ ਸਟਾਰਟਡ ਫੀਲਿੰਗ ਬੈਟਰ ਵਿਦਿਨ ਦੈਮਸੈਲਵਸ ਸੋ ਸਿਰਫ ਮੀਟ ਦੇ ਵਿੱਚ ਨਹੀਂ ਉਹ ਚੀਜ਼ਾਂ ਜਿਹੜੀਆਂ ਆਪਾਂ ਪ੍ਰੋਟੀਨ ਲੱਭਦੇ ਪਰ ਚਰਚਾ ਕਰ ਰਹੀ ਹਾਂ ਮੈਂ ਅੱਜ ਇਹ ਸੈਕੰਡ ਹਾਫ ਦੇ ਵਿੱਚ ਕਿ ਜਦੋਂ ਇਨਸਾਨ ਨੂੰ ਸੱਟ ਚੋਟ ਲੱਗਦੀ ਹੈ ਔਰ ਜਿੱਦਾਂ ਕੋਰੀ ਵੀ ਕਹਿ ਰਹੇ ਸੀਗੇ ਸੋ ਮੈਨੀ ਇੰਜਰੀਜ਼ ਹੁੰਦੀਆਂ ਸਸਟੇਨ ਹੁੰਦੀਆਂ ਇੱਦਾਂ ਦੀ ਮਾਰਸ਼ਲ ਆਰਟਸ ਐਕਟੀਵਿਟੀ ਦੇ ਵਿੱਚ ਔਰ ਉਹਦੀ ਰਿਕਵਰੀ ਕਰਨੀ ਔਰ ਉਹਦਾ ਕੋਲੇਜਨ ਰੀਬਿਲਡ ਕਰਨਾ ਵਾਪਸ ਕੈਨ ਬੀ ਅ ਜਰਨੀ ਸਮਟਾਈਮਸ ਯੂ ਕੈਨ ਬੀ ਪੁੱਟ ਆਫ ਦ ਸਪੋਰਟਸ ਬਟ ਐਜ਼ ਦੀ ਸ਼ਾਮ ਦੀ ਚਰਚਾ ਕਰ ਰਹੀ ਹਾਂ ਮੈਂ ਕਿ ਜਿਹੜੀ ਟ੍ਰਾਈਲਾਈਟ ਟ੍ਰੀਟਮੈਂਟ ਅਸੀਂ ਸ਼ੁਰੂ ਕੀਤੀ ਹੈ ਮੇਰੀ ਕਲੀਨਿਕ ਵਿੱਚ ਉਹਦੇ ਵਿੱਚ ਤੁਹਾਨੂੰ ਕੀ ਵਧੀਆ ਫੰਕਸ਼ਨਸ ਹੈਗੇ ਨੇ ਕਿ ਇੱਕ ਫਿਮਣੀਆਂ ਜਿਨ੍ਹਾਂ ਨੂੰ ਹਾਈਪਰ ਪਿਗਮੈਂਟੇਸ਼ਨ ਹੈਗੀ ਆ ਜਾਂ ਚਿਹਰੇ ਦੇ ਉੱਪਰ ਬਹੁਤ ਬੁਢਾਪਾ ਨਜ਼ਰ ਆ ਰਿਹਾ ਬਹੁਤ ਵਧੀਆ ਤਰੀਕੇ ਨਾਲ ਕੰਮ ਕਰਦੀ ਆ ਜਾਂ ਤੁਹਾਨੂੰ ਵੂੰਡਸ ਆ ਆਫ ਇਨਫੈਕਸ਼ਨ ਜਿੱਥੇ ਪੀਕ ਹੋਵੇ so we'll be talking about that with Felix. Sat Sri Akal.
Sat Sri Akal.
Thank you so much. And Felix, this first part was so inspirational about the devotion of any activity or any person in any art, whether it is a speech or whether it's martial arts or whether it is hockey or football, the endurance, that body, you can take your body to such a high endurance level if you want to. Yes. You can make it as lazy as a couch potato lifestyle, yep. Or you can make it as active. But in that activity, the breakdown of the collagen and the usage of muscles needs repairing. Absolutely. The repair can only happen with ingestion of the 14 aminos and proteins that are your building blocks. Yes. To your muscles.
Every cell in your body as well, not just the mind.
Yeah.
Every cell, skin, hair, skin, nails. Every muscle.
Yeah. And I've had patients doing the Trilight treatment who had infections, who were having, maybe we'll get somebody to come and give us some live input.
This was so profound. I mean, I've seen the pictures and the degree of injury sustained, and this was not an athlete, this was just a regular
wearing a wrong size shoe,
right. And unbelievable that just wearing the wrong size shoe can give you such a bad injury. The leg was almost going to be amputated. And now 2 months off work and now
3 months now
3 months off work, but you got involved when he had been already off 2 months.
2 months, yes.
Leg scheduled to be amputated, and literally within a few weeks you had him walking again through the Trilight treatment.
In 1.5 days.
In 1.5 days.
In 1.5 days, ਜਿਹੜੇ ਪਾਕ ਪਈ ਹੋਈ ਸੀਗੀ ਪੀਕ ਪਈ ਹੋਈ ਸੀਗੀ ਔਰ ਡਾਕਟਰ ਨੇ ਕਿਹਾ ਸੀਗਾ ਕਿ ਇੱਥੇ ਪਲਾਸਟਰ ਲਾ ਕੇ ਹੋ ਸਕਦਾ ਹੈ ਕਿ ਐਂਪੂਟੇਸ਼ਨ ਹੋਏਗੀ ਕਿ ਜ਼ਖਮ ਇੰਨਾ ਡੂੰਘਾ ਸੀਗਾ ਔਰ type 2 diabetes and also put on insulin, so change the diet and to stop the person from having a lifetime disability.
Yeah.
Trilight treatment ਜਿਹੜੀ ਤੁਸੀਂ ਮੇਰੇ previous shows ਦੇ ਵਿੱਚ ਵੀ ਦੇਖੀ ਹੈ ਜਿੱਥੇ ਥੱਲੇ ਦਾ ਨੰਬਰ ਹੈ please call for advice. We've got a caller on here. Let's see who's on air. Hello, Sat Sri Akal and welcome to Ultimate Health Performance Show on this Wednesday evening. Sat Sri Akal.
Sat Sri Akal.
Sat Sri Akal ji. Sat Sri Akal ji. ਸੋ ਅਸੀਂ ਗੱਲ ਕਰ ਰਹੇ ਸੀ ਕਿ ਇੱਕ ਤਾਂ ਪਹਿਲੇ ਸ਼ੋਅ ਦੇ ਵਿੱਚ ਸਾਡੇ ਕੋਲ ਆਇਆ ਸੀਗਾ ਇੱਕ ਮਾਰਸ਼ਲ ਆਰਟਸ ਦੇ ਵਿੱਚ ਜਿਹਨੇ ਪ੍ਰੋਟੀਨਸ ਤੇ ਉਹਨੇ ਆਪਣਾ ਖਾਣਾ ਤੇ ਮੀਟ ਡਾਈਟ ਬਦਲ ਕੇ ਤੇ ਬਹੁਤ ਵਧੀਆ ਇਸ ਵੇਲੇ ਉਹਨਾਂ ਦੀ ਲੈਵਲ ਆਫ ਪਰਫਾਰਮੈਂਸ ਇੰਨੀ ਵਧੀਆ ਹੋ ਗਈ ਆ ਔਰ ਜਿਹੜੀ ਟ੍ਰਾਈਲਾਈਟ ਟ੍ਰੀਟਮੈਂਟ ਮੈਂ ਕਰਦੀ ਆ ਇਹ ਇੰਜਰੀ ਸਸਟੇਨਡ ਇੰਜਰੀ ਜਾਂ ਪਾਕ ਤੇ ਪੀਕ ਤੇ ਕਿੱਦਾਂ ਕੰਮ ਕਰਦੀ ਆ
ਹਾਂਜੀ ਮੈਂ ਤੁਹਾਨੂੰ ਆਪਣਾ ਐਕਸਪੀਰੀਅੰਸ ਦੱਸਦੀ ਹਾਂ ਤੁਹਾਡੇ ਜਿਹੜੇ ਦੇਖਣ ਵਾਲੇ ਆ ਸੁਣਨ ਵਾਲੇ ਆ
ਜੀ।
ਪਹਿਲੀ ਗੱਲ ਤੁਸੀਂ ਸਾਡੇ ਵਾਸਤੇ ਰੱਬ ਨੇ ਤੁਹਾਨੂੰ ਭੇਜਿਆ ਕਿ ਤੁਸੀਂ ਜਾ ਕੇ ਤਾਂ ਏਦਾਂ ਸਾਡੇ ਵਰਗੇ ਬੰਦਿਆਂ ਦੀ ਹੈਲਪ ਕਰੋ।
ਸੁਖਵਿੰਦਰ, ਇਨਸਾਨ ਦੀ ਜਦੋਂ ਲੋੜਮੰਦ ਦੇ ਵਿੱਚ ਹੁੰਦਾ ਉਹੀ ਇਨਸਾਨ ਕਹਿਣਾ ਜਾਂਦਾ ਹੈ। ਇਫ ਅ ਹਿਊਮਨ ਕੈਨ ਨਾਟ ਸਪੋਰਟ ਅ ਹਿਊਮਨ
ਸਾਰੇ
ਬੀਇੰਗ।
ਨਹੀਂ ਏਦਾਂ ਕਰ ਸਕਦੇ।
I know.
ਤੇ ਤੁਸੀਂ ਜਿੱਦਾਂ ਮੇਰੀ ਹੈਲਪ ਕੀਤੀ ਹੈ ਮੈਂ ਉਹ ਤੁਹਾਨੂੰ ਦੱਸਦੀ ਹਾਂ ਸਾਰਿਆਂ ਨੂੰ ਕਿ ਇਹ ਜਿਹੜਾ ਤੁਹਾਡਾ ਟ੍ਰਾਈਲਾਈਟ ਟ੍ਰੀਟਮੈਂਟ ਤੁਸੀਂ ਕਰਦੇ ਆ ਇਹ ਬਹੁਤ ਜ਼ਿਆਦਾ ਬੈਨੀਫੀਸ਼ੀਅਲ ਆ। ਸਪੈਸ਼ਲੀ ਜਿਹੜੇ ਡਾਇਬੈਟਿਕਸ ਆ ਉਹਨਾਂ ਨੂੰ ਤਾਂ ਆਪਣੇ ਪੈਰਾਂ ਦਾ ਬਹੁਤ ਖਿਆਲ ਰੱਖਣਾ ਚਾਹੀਦਾ।
ਹਾਂਜੀ,
ਤੇ
ਹੱਥ
ਪਰ
ਪੈਰ।
ਹੁਣ ਜਿਹੜਾ ਇਹ ਤੁਸੀਂ ਕੀਤਾ ਇਹ ਟ੍ਰੀਟਮੈਂਟ ਕੀਤੀ ਆ ਤੁਸੀਂ ਮੇਰਾ ਖਿਆਲ 2 ਦਿਨਾਂ ਦੇ ਵਿੱਚ ਤਾਂ ਫਰਕ ਪੈਣਾ ਸ਼ੁਰੂ ਹੋ ਗਿਆ ਸੀ।
ਸੀਲ ਹੋ ਗਿਆ ਸੀ। ਹਾਂਜੀ, ਪੀਕ ਤੇ ਖੂਨ ਨਿਕਲਣੋਂ ਹਟ ਗਿਆ ਸੀ।
ਜਿਹੜੀ ਸੀ ਉਹ ਦਿਸਦੀ ਨਹੀਂ ਸੀ ਉਹ।
ਬਿਲਕੁਲ ਬਿਲਕੁਲ। ਸੋ ਕੋਲੇਜਨ
ਪਹਿਲਾਂ
ਬਣਨ
ਹਸਪੀਟਲ ਤੋਂ ਉਹਨਾਂ ਨੇ ਸਾਨੂੰ ਡਰਾਤਾ ਸੀ। ਉਹ ਕਹਿੰਦੇ ਸੀ ਉਹਨਾਂ ਮਾਰਕਸ ਨਿਸ਼ਾਨ ਲਾਤੇ ਸੀ ਪੈਰ ਤੇ
Yeah.
ਕਿ ਇੱਥੋਂ ਕੱਟਣਾ ਹੈ ਏਦਾਂ ਕਰਨੀ
Did you hear what she said? They had already put marks on the feet where to cut it from.
ਹਾਂਜੀ।
So that impressions were created with an indelible ink. My God. Okay, that's chilling, you know, got goosebumps.
ਉਹ ਫਿਰ ਵੀ ਉੱਥੇ ਹਸਪੀਟਲ ਰਹੇ ਉਹਨਾਂ ਨੇ ਐਂਟੀਬਾਇਓਟਿਕਸ ਵਗੈਰਾ ਦਿੱਤੇ ਸਾਰਾ ਕੁਝ। ਫਿਰ ਉਹਦਾ ਮਹਾਰਾਜ ਨੇ ਭਲੀ ਕੀਤੀ ਕਿ ਉਹਨੇ ਡਿਸਚਾਰਜ ਕਰਤਾ ਘਰੇ ਆ ਗਏ। ਫਿਰ ਜਦੋਂ ਤੁਸੀਂ ਦੇਖਿਆ ਤਾਂ ਫਿਰ ਤੁਸੀਂ ਫਟਾਫਟ ਆਪਣਾ ਟ੍ਰੀਟਮੈਂਟ ਸ਼ੁਰੂ ਕੀਤੀ ਤੇ ਉਹਦੇ ਨਾਲ ਹੁਣ ਮਹਾਰਾਜ ਦੀ ਮਿਹਰ ਆ ਹੁਣ ਨਵੀਂ ਸਕਿਨ ਆ ਗਈ ਉੱਪਰ ਅਗੂਰ ਆ ਗਿਆ ਸਾਰਾ। ਤੇ ਬਿਲਕੁਲ ਹੁਣ ਠੀਕ ਆ।
ਔਰ ਆਪਾਂ ਸ਼ੁਰੂ
ਵੀ ਆ ਤੇ ਪਰ ਹੁਣ ਖੂਨ ਨਹੀਂ ਨਿਕਲਦਾ ਕੁਝ ਨਹੀਂ ਨਿਕਲਦਾ।
ਹੁਣ ਜੁੱਤੀ ਪਾਉਂਦੇ?
ਹਾਂਜੀ ਜੁੱਤੀ ਹੁਣ।
ਤੇ ਜਦੋਂ ਪੈਰ ਰਗੜ ਹੁੰਦਾ ਐਂਡ ਦ ਫੁੱਟ ਅਬਰੇਸ਼ਨ ਕੋਈ ਇਸ਼ੂ ਨਹੀਂ ਹੈ?
ਨਹੀਂ ਹੁਣ ਠੀਕ ਆ ਪਰ ਕੋਈ ਖੂਨ ਨਹੀਂ ਵਗਦਾ ਕੁਝ ਨਹੀਂ ਵਗਦਾ। ਪਰ ਹਜੇ ਮੈਂ ਥੋੜਾ ਉਸ ਤਰ੍ਹਾਂ ਹੀ ਰੱਖਦੀ ਆ ਉਹਨਾਂ ਦੀ।
ਜਸਟ ਪਰਹੇਜ਼ ਕਰਨਾ।
ਹਾਂਜੀ।
caution
ਹਾਂਜੀ।
amazing ਸੁਖਵਿੰਦਰ ਜੀ I mean thank you so much। ਪਰ ਇਹਦੇ ਵਿੱਚ ਤੁਸੀਂ ਵੀ ਮੇਰੀ ਟ੍ਰੀਟਮੈਂਟ ਨੂੰ ਕਹਿ ਲਓ ਕੌਨਫੀਡੈਂਸ ਰੱਖਿਆ। ਆਪਾਂ ਫਰਾਈਡੇ ਮੈਂ ਜਦੋਂ ਵੂੰਡ ਦੇਖਿਆ ਆਲਰੇਡੀ ਉਹਦੇ ਪੈਰ ਤੇ ਬੜੀਆਂ ਪੱਟੀਆਂ ਪਾਈਆਂ ਸੀ। ਮੈਂ ਕਿਹਾ ਭੈਣ ਸਾਰਾ ਕੁਝ ਲਾ ਦੇ, ਪੰਜਾਬੀ ਜ਼ਖਮ ਇਦਾਂ ਠੀਕ ਨਹੀਂ ਹੋਣੇ। I even gave you the most amazing capsules and healthy capsules and anti-inflammatory spray ਕਰਨ ਨੂੰ ਵੀ ਦਿੱਤੀ ਪੱਟੀ ਲਾ ਕੇ। ਔਰ ਪੱਟੀ ਦੇ ਵਿੱਚ ਵੀ ਜਿੰਨੀ ਪੀਕ ਸੀਗੀ it was unbelievable. There was no way sweetheart ਕਿ ਇਹ ਇਨਫੈਕਸ਼ਨ ਹੋ ਸਕਦੀ ਸੀ ਮੁਕੰਮਲ by NHS treatment. It would have been a sad state. ਤੁਸੀਂ ਕਹਿ ਰਹੇ ਹੋ ਕਿ ਉਹਨਾਂ ਨੇ ਤਾਂ ਨਿਸ਼ਾਨ ਵੀ ਲਾਤੇ ਸੀ ਕਿੱਥੋਂ ਪੈਰ ਲਾਉਣਾ ਆ। My God.
ਹਾਂਜੀ
ਮਾਰਕਰਸ ਲਾਤੇ ਸੀਗੇ।
ਅਸੀਂ ਤੇ ਘਬਰਾ ਗਏ ਸੀ ਬਹੁਤ ਡਰ ਗਈ ਸੀ ਮੈਂ।
ਜ਼ਿੰਦਗੀ ਬਦਲ ਜਾਂਦੀ ਆ sweetheart। ਮੇਰੇ ਕੋਲ I have got people who neglected their diabetes and neglected their infections who now have amputation. Guess what? I had another patient on Monday who has had amputation.
ਨਾ ਕਰਨ ਬਿਲਕੁਲ ਨਾ ਕਰਨ ਨਜ਼ਰ।
Yeah, I had a person on Monday who I had not seen for 15 years came on a wheelchair from knee down, has not got his limbs. I couldn't do anything because he had neglected his diabetes, ignored it, but I then had to look at his bowel movement and leaky gut syndrome. बहुत कुछ trigger off हो गया। So आपा मिले थानू Friday treatment ਤਿੰਨ ਕੀਤੀਆਂ। Saturday we did 6 doubles and Sunday we did 2.
ਬਾਕੀ ਤੁਸੀਂ ਰਾਤ ਦਿਨ ਇੱਕ ਕਰਕੇ ਤੁਸੀਂ ਇੱਥੋਂ ਤੱਕ ਮੈਂ ਕਹਿੰਦੀ ਮੈਂ ਤੁਹਾਡਾ ਦੇਣ ਕਿੱਦਾਂ ਦੇ ਸਕਦੀ ਆ। ਮੈਂ ਦੇ ਨਹੀਂ ਸਕਦੀ।
You know what? It took me another 2 weeks to catch up on my lost work.
Yeah, no, I'm really grateful.
Yeah.
Thank you
No,
so
it's a
much.
pleasure कि ਅਸੀਂ ਕਿਸੇ ਦੀ ਜ਼ਿੰਦਗੀ ਦੇ ਵਿੱਚ we have saved him from that tragic time कि how would you have lived? You know, even a little finger, even a thumb has got some function. This body ਰੱਬ ਨੇ ਦਿੱਤੀ, there is every movement, every muscle, every nerve ending has got a function connected. But to amputate somebody and leave somebody without that most you know, and leave the person vulnerable, it would have been a tragedy for you, but also for the whole household. Emotions would have changed.
Very true. No, ਅਸੀਂ ਹੁਣ appointment ਤੇ ਗਏ ਸੀ and they were asking me ਕਿ ਕਿੱਦਾਂ ਤੁਸੀਂ ਇਹ ਕਿੱਦਾਂ dry ਕਿੱਦਾਂ ਹੋ ਗਿਆ ਏਦਾਂ।
So they went back 2 weeks later. So I told you ਕਿ ਤੁਸੀਂ 1 week ਨਾ ਜਾਓ. You missed that appointment. We stopped the antibiotics and we stopped the antibiotics and then told you that ਹੁਣ ਨਾ ਲਵੋ ਤੇ ਆਪਣੀ ਦਵਾਈ ਜਿਹੜੀ ਦਿੱਤੀ ਸੀ and spray ਇਸਤੇਮਾਲ ਕਰੋ। And then you went 2 weeks later. I said let them look at the wound. and they were shocked to see and
ਉਹ
say,
ਫਿਰ ਉਹਨਾਂ ਨੂੰ ਮੈਂ
how did it happen?
ਟ੍ਰੀਟਮੈਂਟ ਲਈ ਆ ਤੇ ਉਹ ਕਹਿੰਦੇ that it's we're very happy and carry on ਕਿ ਤੁਸੀਂ ਜਿਹੜਾ ਕੁਝ ਕਰ ਰਹੇ ਆ carry on with it.
Yeah, no more hospital visits, Sukhwinder. Amazing that, going to the hospital itself, it has been so traumatizing for you.
Oh, of course.
And so traumatizing.
You was with me.
I went the one day. When he came out, that's one time when I made the home visit and I said, this has got to stop. We removed all the bandages, which are about 1 inch thick.
Yes.
And then went on
It's
to
like a mummy.
he mummified his feet. Mummified his feet. And the moments I saw him the Friday and Saturday, he was told total bed rest, bed to uthna hi nahi, elevated feet, no work
they were
for
saying
months
they're
on
gonna
end.
Put the plaster on.
Huh?
They were saying they're going to put the plaster
The
on.
plaster would have caused more infection. There was no point of return for a diabetic patient. You are choking something from breathing and from air. It would have been a serious infection. Serious infection.
That's right,
And that point, quarters in centimeter left, would have gone to the bone. The color of the skin, already he had no feeling.
Was it like gangrene or?
It was gangrene.
Now there is. When I touch it, there's a feeling is
He had
there
no
now,
feeling.
thank God.
The gangrene had stepped in. He had no feeling. You would scratch him, he would say, I have no feeling.
Now there
The
is.
swelling te soj chale gayi ya?
Hanji, so
Fantastic. Send me some more images from a good angle with more light. And if I can spare time, I couldn't make it. I'm back from Birmingham and I'll try to see.
No worries, probably whenever you can.
Probably not this weekend. I have got patients from abroad, but soon, early week, I will just see it. But is he planning to go back to work now after 3 months?
Yes, he went yesterday for a little while.
Well, congratulations.
Congratulations.
And then, yes.
Men are meant to leave home and come back home at 4 or 5 p.m. Bring the bread home. Although women are also supposed to bring the bread home, but to have a man, sitting on the couch, unable to get up and feed himself or even to get a glass of water, it became seriously, detrimentally of disability.
I just took him yesterday to the office and then he just stayed there for about an hour or so, then I brought him back home.
What a change.
Just to get him out for a little while.
Good. And obviously makes one feel happier because bamari de vich banda can go into depression and you feel like, the world is closing up on you because the work is your inspiration.
Dukh bhariya, bahut, I tell you, jehda bande nu, jehda nangyya vichon di ਉਹਨੂੰ ਪਤਾ.
I know. I don't know how many towels did you wash a day with the peak and the coon dripping all over to just about 30 steps to the washroom. There was a whole track of his DNA, of his blood that she had to keep washing and cleaning. But so nice. Thank you for your feedback. The Trilight treatment.
And this weekend it's Mother's Day and happy Mother's Day to all the mums.
All the mothers of the world and the Women's Independence Day, respect to every woman in politics, every woman in medical career, every woman in every career, every woman, and you as a nurse. You were his nurse.
Thank you.
You were Mother Teresa for him. Had you not nursed him, you were that pillar of strength. The length of walk you had to do just to get to the hospital. I couldn't believe she had lost about 3/4 stone. Just walking up and down to the hospital. The journey itself was all traumatizing. Sweetheart, I wish you very healthy recovery the wound is sealed. The doctors are super impressed. They didn't even believe. They said, we don't know there's a Trilight treatment that can close a wound of such kind.
But
which was so
they
deep.
helped us a lot as well. Thanks to them as well. They helped us amazingly.
In dire emergency, NHS is amazing.
Absolutely.
We are never going to condone this. I know when my father was taken.
Thank them enough either.
Sorry?
I can't thank them enough either.
Of course.
They were amazing as well.
Of course. Because you had no solution at that time. You hadn't approached me. It was by the way that we contacted, and that's when I made the hospital visit. But at the hospital, I couldn't have done anything. Thank you for taking the trust in Trilight. Thank you for your feedback. God bless you. And good luck for your family's good health and stay happy.
Best of luck.
Thank you. So that was an amazing journey. I didn't know that they'd already put markers. Yeah?
Yes.
Because the skin had gone so black, I couldn't even see where the markers were.
You have to, that's the difference you've made there, and you do on a daily basis, almost, just without noticing the impact that you're doing. It's truly a great thing.
Yeah.
But we've talked on, Trilight and the relevance for athletes, for critical incidents of surgery. Even for beautifying, it can
Yes.
work really well. If someone's had too much sun, so let's lighten it a little bit and talk about what are the beauty aspects, and for someone who doesn't have an injury but maybe has a skin condition of some sort, whether it's too much sun or acne. Let's talk a little bit about how Trilight can help.
Amazing. Trilight is the blue, the red, and the near infrared light. And these lights, if Felix is learning to know your gadget and learning to use it. We all have gadgets in the house. I have 3 phones, and if I don't use 50% of the app on my phone because
Yes.
I don't have time to learn. If I didn't use that machine and the right program, I would have not seen that improvement of recovery. And having to sit there all Saturday, in their environment and change all my, which took me 2 weeks to catch up.
Yes.
After that, and I felt like, when will I catch up? When will I catch up on my work? And then the Sunday, and then on the Monday we were doing the cook shows, and I said to her, today I can only do 2 treatments. I cannot come out on a Monday. And that's when I said, realize that this treatment, if it's followed in a structured way, and your gadget, you have passion, you have the drive to help and heal somebody, and your aura is positive, not looking at the monetary value of it, making sure that that person is going to heal, because in dire emergency illness, the patient is at its lowest. You need to be giving them that uplift,
100%. Look,
And the first thing I walked in and I said, MS, it's my way or no way. He said, Dr. Seba, it's your way. I have got no way. It's no entry right now. You need to get me out of this sticky situation. And I've never seen him shed tears. He's such a boisterous man. And I just had to be cruel to be kind. And that meant there was a lot of things that had to be cut out in food.
Yeah.
Being diabetic, having put him on insulin, we've managed to control that. There's a lot of foods that I'll still be looking at. So when I gave him that one threat, is my way or no way, he was ready to change and not put the food in his mouth, which he would ask normally for the family. But capacitated, it can be such a nasty journey. But acne, I've seen amazing results. I've seen amazing results with psoriasis and eczema. With sunburns, we've seen a new layers of skin come from underneath, and this is Trilight elegance treatment. It's non-invasive.
Yes,
I'm not injecting anything what people are doing and girls are doing. Do you remember I mentioned to you a figure of girls spending anything to 150 to 500 pounds a month on beauty products?
Wow.
Which could be creams, it could be anti-aging. But what breaks down the collagen in the first place is sugar. The deadly white sugar breaks the fibrins on of your collagen, and they will just have a wider gap, and the wrinkles step in. The plumpness goes away.
It's so important because, I was talking to a number of ladies yesterday, and, in the case of someone who's a long-term vegan, what we see is, some issues around not getting sufficient protein into the body. And this is why it's so important to supplement and have a broad-ranging diet, because even as a vegetarian or plant-based person, you've got to have this density and diversity of diet, which, given the more intensive production techniques used, you get into, as Corey was saying, you get into the situation where what you should be eating is so much that you couldn't eat it. And so it's easier and more convenient to do it in a supplement form alongside the best diet that you're comfortable with.
Yeah, with a proper clean water. And that mix is ready. It's gone through formulation. It's gone through labs. It's gone through scientists who have tested these products. And every dose is measured in specific doses that you don't have to sit and say, how much do I need to add?
It's exactly that. That particular green stuff, it's the only one on the market that supports all 12 body systems. It won the Institute of Functional Medicine Awards, which is both medical and naturopaths, because it systematically supports all 12 body systems.
Yeah.
So there are fantastic products on the market that are available.
Yeah. So मैं थोड़े ਜਿਹੜੇ ਪੰਜਾਬੀ ਭਾਸ਼ਾ ਵਿੱਚ ਦੱਸਦੀ ਹਾਂ ਕਿ ਜਿਹੜੀ ਟ੍ਰਾਈਲਾਈਟ ਟ੍ਰੀਟਮੈਂਟ ਅਸੀਂ ਕਰਦੇ ਹਾਂ ਉਹ ਪੀਕ ਵਾਸਤੇ, ਜ਼ਖਮਾਂ ਵਾਸਤੇ, ਡਾਇਬੀਟੀਜ਼ ਦੇ ਜਿਹਦੇ ਕਈ ਜ਼ਖਮ ਹੈਗੇ ਨੇ ਤੇ ਗੈਂਗਰੀਨ ਆਉਣ ਦੇ ਵਿੱਚ ਕੋਈ ਇਸ਼ੂ ਹੋ ਰਿਹਾ ਕਿ ਅੰਗ ਲਾ ਦੇਣਾ ਇਨਸਾਨ ਦਾ ਐਂਡ ਦੈਨ ਉਹ ਬੰਦਾ ਵੀਲ ਚੇਅਰ 'ਚ ਚਲ ਜਾਂਦਾ ਜਾਂ ਦੋ ਉਂਗਲੀਆਂ ਲਾਤੀਆਂ ਪੈਰ ਦੀਆਂ. ਇਟਸ ਅ ਨਾਰਮਲ ਸਟੋਰੀ ਵੈਨ ਆਈ ਸੇ ਟੂ ਪੀਪਲ ਕਿ ਮੇਰੀ ਆਪਣੀ ਜਰਾਬ ਲਾ ਕੇ ਪੈਰ ਦਿਖਾਓ ਕਿੰਨੀ ਫੰਗਸ ਹੈ. The first thing they'll say is, oh, I don't have 2 toes. Oh, what happened? It was gangrene. It looks like in the 21st century, 21ਵੀਂ ਸਦੀ, we have not captured gangrene. You know, what is wrong? Is this our diet? Is this what ਅਸੀਂ ਆਪਣੇ ਮੂੰਹ ਚ ਪਾ ਰਹੇ ਹਾਂ is becoming poison for us? You know, sugar, white sugar, one of the most deadliest white, legal drugs. In my cook shows, which are every Wednesday at 7:30,
Yep.
every Saturday at 11:30 a.m. We are bringing in all protein-based foods all the time.
It's all about density and diversity, and those cook shows, I particularly like it on a Saturday, easier for me to catch, but what you do so well is to really try to incorporate all of the colours of the rainbow in every dish. So it's so colourful, so flavourful, and you're doing a great service there, just guiding people into a more plant-based diet.
Yeah, exactly. I mean, imagine I've got Felix who's English. He could have said to me, I am a meat person, I need my steak. But he's converted, and Corey, he's converted and seen the rewards. ਅਸੀਂ ਜਿਹੜਾ ਇੱਥੇ ਚਰਚਾ ਕਰਦੇ ਹਾਂ and we are speaking, ਸਾਡੇ ਗਲੇ ਵੀ ਸੁੱਕ ਜਾਂਦੇ ਨੇ purely ਕਿ ਅਸੀਂ ਤੁਹਾਨੂੰ ਇੱਕ ਰਸਤਾ ਦਿਖਾਈਏ. Being an Ayurveda, doing homeopathy, naturopathy, acupuncture, now Trilight, as a colon specialist, what you put in your mouth must come out of the unwanted, undigested food. If you don't chew, it will certainly come out in the same bits and forms, or it will stagnate on the side. So, mind, body and spirit, this balance has to be so profoundly right ਕਿ ਸਾਡੇ ਤੇ ਗੁਰੂਆਂ ਨੇ ਸਾਨੂੰ ਸਿੱਖ ਹਿਸਟਰੀ ਦੇ ਵਿੱਚ ਇਹ ਦਿੱਤਾ ਹੀ ਹੋਇਆ ਨਾਮ ਸਿਮਰਨ, ਖਾਣਾ ਵਧੀਆ ਖਾਓ, ਬੈਠ ਕੇ ਖਾਓ, ਸ਼ਾਂਤੀ ਨਾਲ ਖਾਓ. When your adrenaline is high, you must not eat for 45 minutes and let that adrenaline come down. Food on the go is the dangerous one. Eating in the car, I think I heard that the police charge you now if you're eating in the car.
I hadn't heard that, but just to...
a lady was fined for eating an apple about 8 years ago.
Yes, but she was doing a U-turn and holding up traffic while she was trying to eat.
Right. I can't remember the whole thing about it.
But in truth, have joy in everything. We're not saying if you have shifts, there are things that you like to eat. What you're doing 80 to 90% of the time is what really matters, and that's the big difference between being plant-based or kind of like a vegan. You don't have to be, some people choose to be vegan every single day, but plant-based is what you're doing 80-90% of the time.
Yeah.
And it's where you're getting the density of your nutrients and diversity from. So enjoy the social occasions of eating as well, and just have fun.
We were at a social event. We made choice of what we wanted. There was a lot more we could have chosen, both of us. I brought my chicory and dark chocolate and I shared it. The 80%, 100% dark chocolate was dissolved. You didn't give me a feedback on that.
It was beautiful and so enlivening as well.
Yeah. It just gives you that.
It does, doesn't it?
Yeah. I've got it here today as well. So I'll be ingesting that. So really, taking teas and black coffee, yes, but which is filtered is good, but not just the instant ones. Filtered coffees a couple of cups are good for the heart, but not something before bedtime because it might just keep you awake and you'll be counting the sheep, So collagen and food, which is very good for collagen, obviously, is the orange fruits, orange vegetables. Why has God given us these colors? And why is it that only a human being can see colors? No other animal can see color?
I didn't know that.
No, they're all black and white.
Okay.
Yeah, when there was total eclipse in Kenya in late 1970s, a scientist approached from every part of the world. And being in Kenya, we were told to wear special glasses, which might affect our eyes. And the scientists went to various parts of Nairobi and Kenya to see the behavior of animals. And that 7-minute eclipse, all the cows started going to the shelter and the sheep and the flock. They thought, oh my God, And as the sun came back out, they realized, oh, confused.com, what's happened? We never slept the night. The sun is out again. And they understood from that, this amazing eye image that we have, we can see the colors of the world. God has given us the rainbow vegetables of the world. The most magical life we've got, we can either make it as, and put it in the gutter, or we can keep it middle performance or top performance, your choice. Choice of your food through my observations and advice, and through what Felix says about proteins and I say about proteins, and we carry on till our throats are dry.
But hopefully we're giving great value, and hopefully you're enjoying the show. Please give us your feedback.
Yeah. So जिन्हों ने आज दा शो देखा, मेरे आने वाले शो दे विच जरूर चर्चा करांगे, थोड़ा पंजाबी, थोड़ा इंग्लिश, थोड़ी देसी पंजाबी बोलांगे, सारियां नु खुश रखांगे। खुश रहो, आबाद रहो, जिंदा रहो, अकाल चैनल नु सपोर्ट करदे रहो। फीलिक्स अति धन्यवाद, शुक्रिया।
I didn't catch it.
Means thank you.
Thank you.
Tanwad means thank you. So another 2 words in his vocabulary are going to come back very soon. But he's so magical. He's inspiration to me, and we each one inspire each other to talk.
So true.
Isn't that true? I could have a lazy speaker who would probably be jittering, but each person's aura in the house, in your friendship circle, in your sports circle, let it be positive. Stay positive on this note. Stay tuned into the next health show next Monday. That's the date, 9:40 p.m. Stay tuned and give us a call on the number running on the scroll below. Good night.